Welcome to our exploration of reproductive health and hormones, the invisible architects shaping our bodies and life stages. In this presentation, we'll introduce the chemical messengers that control fertility, growth, and changes across the lifespan, setting the stage for why understanding hormones matters for health, relationships, and life planning. Hormones act as the body's chemical messengers, traveling through the blood to deliver precise instructions to distant organs. They form a communication network that coordinates growth, metabolism, mood, and reproductive function, and even tiny amounts can trigger powerful effects by binding to specific cellular receptors, illustrating remarkable precision in biological regulation. So, what exactly are hormones, and why do they matter? Hormones are specialized chemicals circulating in the blood that regulate bodily functions with fine-tuned accuracy. More than 50 different hormones work together like an orchestra, directing growth, metabolism, mood, and reproduction. And even minute concentrations can cause significant cellular responses by activating target receptors. The endocrine system is the control center for reproductive health, centered on glands like the hypothalamus and pituitary, which send signals to the ovaries and testes. These organs produce sex hormones that drive puberty, fertility, and sexual function, and they operate within intricate feedback loops that keep hormone levels balanced throughout life. Now we'll take a closer look at the main reproductive hormones that steer fertility and sexual development. Understanding these key players helps explain how cycles, puberty, pregnancy, and aging unfold, and prepares us to recognize when hormonal communication is functioning normally or when it needs clinical attention. In females, estrogen and progesterone work together in a coordinated rhythm. Estrogen supports secondary sex characteristics, bone health, and prepares the uterine lining, while progesterone readies the uterus for pregnancy and stabilizes the cycle. Their cyclical interplay orchestrates ovulation and fertility, and shifts in their balance explain many reproductive symptoms and life stage changes. In males, testosterone is the primary sex hormone driving sperm production, muscle mass, libido, and energy, while dihydrotestosterone, or DHT, is a potent derivative that influences pubertal changes like facial hair and voice deepening. Both are produced mainly in the testes and kept in check by pituitary signals to maintain reproductive health and overall well-being. The pituitary gland controls the gonads by releasing two key hormones, FSH and LH. Follicle-stimulating hormone promotes egg maturation in females and supports sperm production in males, while luteinizing hormone triggers ovulation in women and testosterone production in men. These gonadotropins are tightly regulated by the hypothalamus to coordinate reproductive cycles and fertility. Anti-Mullerian hormone, or AMH, acts as a fertility gatekeeper by regulating early follicle development in the ovaries and indicating ovarian reserve. In fetal males, AMH causes regression of female reproductive ducts to ensure male anatomy develops correctly. Clinically, AMH levels help guide fertility planning and assess reproductive potential with more clarity than many other tests. This section looks at how hormones shape us from puberty through aging and why timing matters. Hormonal regulation across life stages influences physical maturation, reproductive windows, pregnancy, and the transition to menopause. As hormones rise, fall, and shift, they create predictable life stage patterns that affect health, fertility decisions, and long-term well-being. Puberty begins with a hypothalamic trigger that releases GnRH, setting off pituitary release of FSH and LH, and activating the gonads to produce sex hormones. In girls, this typically leads to breast development and menstruation between ages 10 and 14, while in boys, rising testosterone and DHT produce voice changes and muscle growth. Usually, around ages 12 to 16, the menstrual cycle is a hormonal symphony with distinct phases that prepare the body for pregnancy. During the follicular phase, FSH stimulates follicle growth and estrogen rises, A sharp LH surge then triggers ovulation at peak fertility. The luteal phase follows with progesterone support for implantation. And without pregnancy, hormone levels fall, leading to menstruation. Pregnancy relies on a complex hormonal collaboration to support new life. HCG signals early pregnancy and maintains the corpus luteum. Sustained progesterone protects the uterine lining and prevents premature contractions. Prolactin prepares the breasts for milk production, and oxytocin later drives labor contractions and facilitates breastfeeding through milk ejection. Menopause marks a natural hormonal transition when ovaries decrease estrogen and progesterone production, typically around age 51 on average. Menstrual cycles become irregular and then cease, ending reproductive capacity, and many women experience symptoms like hot flashes that can be managed with lifestyle changes and, when appropriate, hormone replacement therapy under medical guidance. Now we'll look at common reproductive health conditions influenced by hormones and why recognizing them matters. Hormonal imbalances can affect menstrual regularity, fertility, mood, and metabolic health, and understanding these connections helps patients and clinicians choose effective management strategies and targeted treatments. Polycystic ovary syndrome, or PCOS, is characterized by elevated androgens, insulin resistance, and disrupted ovulation, often causing irregular periods, acne, excess hair growth, and weight challenges. Management focuses on lifestyle changes, metabolic and hormonal therapies, and fertility treatments when needed to restore cycles and improve long-term health. Premenstrual syndrome is a common, often cyclical set of physical and emotional symptoms many experience before menstruation, including mood swings, bloating, and fatigue. A smaller subset has PMDD, a severe form that can profoundly impair daily life with intense mood shifts and anxiety. Effective approaches include therapy, medication, and lifestyle adjustments tailored to symptom severity. Endometriosis involves growth of uterine-like tissue outside the uterus, typically affecting ovaries, fallopian tubes, and pelvic structures, and it responds to estrogen by thickening and bleeding with each cycle. Symptoms often include severe pelvic pain and fertility challenges, and treatment ranges from pain relief to hormone suppression and surgical removal in more severe cases. Male reproductive disorders often reflect hormonal disruptions such as low testosterone, which can reduce libido, muscle mass, and bone density, or low sperm count, a leading cause of male infertility influenced by hormones, varicosities, or environmental factors. Proper diagnosis examines endocrine signals like inhibin and FSH to restore balance and guide treatment. External factors and synthetic substances can disrupt our internal hormonal balance, so environmental exposures matter for reproductive health. Pollution, industrial chemicals, and some plastics contain compounds that mimic or block hormones, potentially affecting puberty timing, fertility outcomes, and the success of reproductive treatments, which is why mitigation and regulation are important public health measures. Endocrine disruptors such as flame retardants, plasticizers like BPA and phthalates, and certain pesticides can interfere with thyroid and reproductive hormones. Exposure during critical developmental windows may alter puberty timing, fertility, and pregnancy outcomes, and ongoing research is working to clarify these risks and inform safer consumer and regulatory choices. Synthetic hormones and anabolic steroids are substances that mimic testosterone and are sometimes misused to enhance performance, but they carry serious health risks. Long-term use can lead to liver damage, cardiovascular disease, infertility, mood disorders, and premature baldness, making natural training, nutrition, and medical oversight the safer paths to fitness and hormonal health. Scientific advances are transforming reproductive health by improving diagnostics, treatments, and personalized care. Progress in laboratory techniques, reproductive medicine, and targeted therapies is empowering individuals with better fertility options, improved menopause management, and tailored interventions that account for each person's hormonal profile and life goals. Measuring hormones for diagnosis and treatment is becoming more precise and personalized. AMH testing helps assess ovarian reserve. Comprehensive hormone panels guide fertility and replacement therapies, and personalized medicine uses individual hormone profiles to tailor treatments, improving outcomes for fertility, menopause, and other reproductive disorders. In summary, hormones are vital architects of reproductive health and lifelong well-being, and understanding them empowers informed decisions about fertility, symptom management, and preventive care. Continued research and education are unlocking better treatments and personalized strategies. So consult healthcare providers for testing and tailored plans that match your needs and life stage.